Process of remedy selection, we have these three stages are there actually. One is case taking actually, and another one is case analysis and materia medica actually. That what we are case taking from a patient, collecting the symptom, and how we are bridging this to the materia medica. There comes our role actually. Okay. So why well selected remedy fails? Okay. Why I have a doubt in my prescription, even after a complete case taking, detailed analysis and repeated confirmation of the remedy actually. Many of us will have we have doubt in our own prescription actually. I do have this doubt actually in my initial practice of first 1 or 2 years actually. So why it's happened? And put a thought in this way also. We have our own method of prescription actually. We have an experience in that method also of prescription. Maybe 1 or 2 method. Okay, but we have our own method, experience, and each one will have their own method of prescription. Okay, maybe it's from the years together, according to our clinical experience, it will come actually. So, and some methods of prescriptions are there actually. Like for example, diagnostic levels of prescription. Maybe I prescribe from a diagnosis point of view. Maybe I see a patient in the diagnostic point of view, like they have a diabetes, or they have a rheumatoid arthritis, or they have a fever, and I am prescribing a remedy for that. That this remedy is for jaundice. This remedy is for for diagnosis level. Or I am prescribing from the method of single PQRS symptom actually. Okay, single PQRS symptom. I know many PQRS symptom. If the patient said that one PQRS symptom, I can just take that remedy actually and giving. And maybe third level, mind symptom. I'm seeing only the mind symptom and mental general of the patient. With that thing, I'm prescribing actually. I can able to understand the person or a personality with the mental general. I can tell, okay, this is this remedy. I'm prescribing. Or I am depending on the repertory chart actually, or repertorization actually. So I'm following a thematic way actually. Like for example, these remedies are natrum like remedies or acid like remedies actually. It depends upon it's like an injury remedy. Okay, like kind of that actually. We'll ready okay, this whatever this remedy, this belongs to some injury remedy. This belongs to some natrum group of remedy. Like that. Okay, or some sensation point of I know. Okay, some are practicing from sensation method actually. Okay, from this sensation, okay, we will understand that person and we are connecting to giving it. So, and we have much of methods like this. Okay, so we have multiple methods, and we have our favorite and our own methods also. Okay, next, which is the best method actually? Can anyone say which is the best method? Every method is the best method actually. That's the problem here. I can say actually the practitioners who are practicing on diagnostic level or a single PQRS level or a repertory level or any method level, even thematic or sensation level, they have a good practice actually. Every method is a best method, but I think that well selected remedy sometimes fails actually. Why is that? Even all the methods are correct actually. All the methods are best method. Every methods are giving the result actually, but sometimes we fail. So why? Just put this thought. Can I depend on one method of selecting remedy for all the patients who are giving different form of symptom? Just think. I'm depending on one method, and this is my best method. For example, I'm depending on a sensation method. I'm depending on a thematic method. I'm depending on a repertory method. I'm depending on a therapeutic method. Or maybe 1 or 2 method, depending specific to me actually. What I like, what I can do actually, or what I know, what I experience from I'm doing. Can I depend on that 1 or 2 symptom actually? But see from the patient point of view, patient are from the different levels actually. Patient is giving mind symptom, patient are giving physical symptom, everything the patient are giving it in different way. patient are giving. Patient will not give only the diagnosis. Patient will not give only mind symptom actually. Okay. Next, who is going to select the method for patient? Many methods are there and many homeopaths are following their own methods actually. Okay, for a patient, who can select that method? Either the doctor or the patient, either me or the patient. As we believing in individualization, okay, the patient need their individual method. They are telling, like, for example, in this way, doctor, physical symptom is in this fashion. It is in the diagnostic point of view, and my mind symptom is in the PQRS point of view, and my stress history, my past history with the repeated stressful situation, it is in the sensation point of view. Who knows actually whether the patient, all the patient is coming with the same sensation? No. All the patients are coming with the, every patient coming with the form of rubric? No. Every patient is telling only this diagnostics? No. So the patient only can select what method they want. The patient can need any method or more than one method. So the patient can belongs to any method, or and they are not depending upon one method actually. At the same time, they can give a diagnostic, a rubric, and a sensation also. So we need to know everything. We need to be mastering all the methods. You need to be mastering therapeutics. We need to be mastering repertorization. We need to master in the mind symptom. Anything, any methods actually. So-called methods are thematic methods, sensation, anything, and integrate everything. It's not like one time one. Integrate everything. Actually, together you should approach a patient. So this is the way homeopaths are specialists in all the methods actually.